Hi, this is Dr. Paim Zan. We're going to be talking about cortisol and how it works in the body. Cortisol is a really important hormone. It's part of what regulates our sleep-wake cycle. So when we get up in the mornings, our cortisol is nice and high, our melatonin is low. As the day goes on, they'll kind of switch positions so that by midnight, our melatonin is starting to peak and our cortisol is low. It's really important for maintaining some of our adrenal health. That's where our cortisol is produced, in addition to other important hormones and neurotransmitters. But cortisol is really key for getting that sleep-awake rhythm on track. And some of its main functions in the body are that it helps to keep you awake and alert. That's because it does that by increasing some of our blood sugar levels to some extent. Whenever somebody has any kind of poor sugar control or insulin insensitivity, that can cause cortisol to inappropriately come up at night while people are sleeping and disrupt sleep. So this is a big thing we want to keep in check at nighttime as well, to make sure that it's not inappropriately coming up. As far as some of the testing is concerned for cortisol, we can test this a variety of ways. There is blood testing that can be done. The blood testing gives us a snapshot in time of what the cortisol level looks like at that moment. So that can be a useful thing to utilize just to kind of keep track of where things are. There's also the carrier protein for cortisol called cortisol binding globulin, which is important because that gives us a longer term indication of where the cortisol levels are. The other way to look at it, which is a little bit more of a comprehensive way, is to do salivary cortisol testing, which is usually done at 4 different times throughout the day. So you can actually see that trend of the cortisol from morning to noon to afternoon to nighttime. And you should be able to see it kind of gently slope down over that time period. So that kind of helps us to know if there's any particular period of time during the day in which the cortisol levels are inappropriately high or inappropriately low, and we can start to do some things to really help adjust that over time. So some things that can really adversely affect cortisol levels are going to be dysregulated sleeping schedules, certainly. So people working night shift, people that are under a high level of stress, that causes a lot of cortisol to be released to allow that blood sugar to come up a little bit and allow you to stay focused and attentive to some extent. That's all going to be a big part of the dysregulation. People are not getting enough sleep. Patients who have sleep apnea, and even if they're getting enough hours of sleep, if they're not fitted with any kind of particular breathing device, they can't get enough oxygen into the system. So there's a lot of different factors that can cause some of this cortisol imbalance. But it is really important, not only for our blood sugar regulation and sleep-wake rhythm, but cortisol and melatonin also have differing effects on our immune system function. So when cortisol is high all the time, that's kind of suppressing immune system function a little bit, whereas melatonin stimulates immune system function. So that's also going to play a big role in what our immune system function looks like over time, and how well we're able to stand against viruses, bacteria, mold species, etc., that we're exposed to in the environment. There's a lot of different ways that we can go about controlling cortisol levels and helping to readjust them. One important foundational thing is going to be setting regular sleep time and regular wake times. Another important thing can be actually increasing the heart rate within the first 5 minutes of waking. That can stimulate cortisol release at a particular time period. And allowing natural light to come in, or any sort of light source to come in the mornings when you're first getting up. That combination of increasing the heart rate and getting light exposure is going to train the brain over time to stimulate cortisol at that particular time. And as long as you're consistent with the timing, that can really help to adapt when that spike is going to happen for your system. The other important thing is to not allow for cortisol release to be high at night, which can happen as, if you've had a prolonged time of fasting, or if you had a lot of carbs or sugar sources at dinner time, that'll cause the blood sugar to come up and then start to really come down after a few hours. Then it's going to be up to the cortisol to bring it back to baseline, and that can really disrupt the sleep and disrupt your cortisol melatonin rhythm. So it's important at dinner time, at least, to be having a good source of fat, protein, and fiber to really buffer blood sugar over that time so that you're not causing inappropriate spikes and dips. Those are some important, easy lifestyle things to do. As far as further intervention is concerned, there are some beneficial fats like phosphatidylserine, which can be really helpful in reducing cortisol release. There's certain herbs that can be utilized as well that are somewhat adaptogenic that can help with cortisol melatonin balance. Things like ashwagandha, rhodiola, quite a number of things that you can actually utilize to help to mitigate or balance some of those cortisol levels. If you'd like to find out what your specific cortisol levels look like and what some of the carrier proteins for the cortisol look like and some strategies that can be more specific to you, contact us at LIVV and we can get started on testing and find out a particular treatment plan for you.